In the maternity hospital received first pregnant, not undergoing physio-psycho-preventive training. Established the beginning of the first period of labor. Blood pressure is normal. In such a situation, to obtain a sedative effect, you can use Seduxin, belonging to the group of Ataracts. 2 milliliters of a 0.5% solution, 10 milligrams, is injected intramuscularly. It can also be administered intravenously in a glucose solution. It is advisable to conduct Aprofen and Nochar degree. They have a spasmolytic effect on the cervix and, in addition, Aprofen increases the contractile activity of the uterus. The contractions in pregnant frequent, but the behavior was calm. When opening uterine for 4 cm or more, you can keep a mixture of 20 mg of Dimedrol and 20 mg of Prometal in a solution of glucose. The combination of the Seduxin with the analgesic Prometal is called ateralgesia. This woman in labor began giving birth at 2 in the morning. She did not sleep, tired. Contractions became less frequent and somewhat weakened. Opening uterine 5 centimeters. Before deciding whether to rebirth, you must provide a woman rest. It was decided to do this with steroid anesthesia. Viadril has anesthetic effect, leading to sleep for 2 to 3 hours. 500 mg of Viadril G diluted in 10 ml of 0.25% solution of Novocaine and injected intravenously quickly. To obtain an analgesic effect, premedication with Prometal and Dimedrol is necessary. Viadril relaxes striated muscles, but provides a good contractile activity of the uterus and the rapid opening of uterine. When steroid anesthesia is necessary to monitor the condition of the woman during sleep. Contractions continue and intensify, the fetal heartbeat does not change. By the beginning, the laboring woman wakes up, a child is born without signs of respiratory depression. This woman at the end of the first stage of labor. Contractile activity of the uterus, which is recorded by the device, good. Opening uterine 8 cm. By the end of the first. At the beginning of the second stage of labor, it is undesirable to inject analgesics by injection, since their concentration at the time of the birth of the child may remain high and cause him respiratory depression. It is more appropriate to apply inhalation autoanalgesia. The most common is inhalation of nitrous oxide with oxygen using the apparatus NAP60 or Avtonarcon. The dosimeter indicated oxygen concentration. Nitrous oxide supply is limited to 75%. Its concentration can be changed individually for each woman in labor. Here is another woman at the end of the first stage of labor. The mother is trying to push, but premature attempts will tire her and can cause violations. Placental circulation. Anesthesia should be done by inhalation. In addition to nitrous oxide, you can use Pentrin or Trilin. Pentrin, in a concentration of 5.8% by volume, provides good analgesia. A simple gas-air inhaler VDN Trilon VDK is used, which a woman uses only during a contractions. Gas is quickly eliminated from the body after the termination of autoanalgesia. Pentrin can also be applied through the manual evaporator analgizer. After the required concentration of the anesthetic, pregnant falls asleep and the device loses hermetic sealing.